your own health has been the leading impact,
Yeah.
why you decided to start Zeus Men's Health.
Mm-hmm.
So I guess the consumer out there who might be listening, go ahead and give your 3-minute pitch of who you are, who you help, and how you help them.
The holistic approach starts from how patients feel. I think a lot of companies that basically are giving you the cookie cutter approach, right? Which is basically like, okay, everybody who has low testosterone is going to get testosterone, and everybody who has erectile dysfunction is going to get Viagra. But for us, it's more about spending the initial period of time on the initial consult to really get to know the patient. What's the person's life like? What's their social situation like? How's their marriage? These things all matter, right? When you talk about somebody, for example, with erectile dysfunction, one of the biggest things is you have to ask, did this happen out of the blue, or did this happen gradually over time, right? And so if it's something that happened out of the blue, a lot of times it's just something like stress. It could be work, it could be relationships. And if you're not asking these questions and you're not getting to the root cause analysis of what somebody's issues are, and you're just prescribing them a medication, then they're better off, not even seeing a physician, right?
Right.
So what you're getting with me is it's a personalized approach. It's about establishing a relationship, figuring out exactly what's happening with someone's health from top to bottom, and then seeing what can we optimize in terms of their preferences too, right? Some people really care about their hair, and some people really care about their muscle mass, okay? And so the treatment for those two patients from the standpoint of testosterone are very different, right?
Right.
If you blast somebody who has a full head of hair and cares more about that, and say, for example, fertility is really important, they're trying to conceive, and you just give them testosterone, well, now they might lose their hair, they might lose their fertility, right?
Right.
And they might build some muscle, but that's not what they wanted.
Right.
And so it's a matter of asking people like what they want. It's not about treating a number,
Right. So there's some serious complications that can arise from the wrong dosing or the wrong provider, possibly.
Exactly. And it's so important that everybody's story is unique,
Right.
And that's where the physician part of it comes in.